Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the facial nerve. The facial nerve is a mixed nerve. It has motor component and sensory component, and it has three nuclei. The motor nucleus, here is the motor nucleus, okay, and we have the sensory nucleus. We have the sensory nucleus. Here is the sensory nucleus. And we have also the parasympathetic nucleus. This is the parasympathetic nucleus. Okay, they all are located underneath the floor of the fourth ventricle. This is the fourth ventricle, and they all are underneath the fourth ventricle. The motor nucleus turn around the nucleus of the adjacent nerve. It forms the facial colliculus here. Okay, so we got that. So all the nuclei are located in the pons. This is the pons area. The motor nucleus innervates the muscles of facial expression. All the muscles of facial expressions are innervated by the motor nucleus, and these are developed from the second pharyngeal arch. It innervates the muscles of facial expression, auricular muscles, the stapedius muscle in the middle ear, posterior belly of the digastric muscle in the digastric triangle, and also the stylohyoid muscle that connects the styloid process to the hyoid bone. Okay, if we go there, then here, if we look at the brainstem, this is the part of the midbrain here. This is the pons. This is the medulla oblongata. The facial nerve root is here. We have the motor root, and we have the sensory root here. This is the facial nerve. This is the facial nerve. This is the sensory root of the facial nerve, and this is coming out from the lower border of the pons and upper part of the medulla oblongata, lateral to the abducent nerve. This is the facial nerve. And we are also looking at the innervation. The motor component innervates the muscles of facial expression, like that of the orbicularis oculi muscle, orbicularis oris muscle, the platysma muscle. Okay, so these all the muscles of facial expression are innervated by the facial nerve. Plus we have the auricular muscles and also the posterior belly of the digastric muscle and the stylohyoid muscle are innervated by the motor nucleus of the facial nerve. Okay, the parasympathetic nuclei of the facial nerve, we have the two components. One is the superior salivatory nucleus, supplies the submandibular and sublingual gland. Here is a sublingual gland, here is a submandibular gland. Okay, via the submandibular ganglion. Okay, this is the superior salivatory nucleus. Here, just medial to that, we'll get the motor nucleus. This is the superior salivatory nucleus. The lacrimal nucleus supplies the lacrimal nerve. So here, if we go there, this is the pterygoplatean ganglion. We'll going through that lacrimal nerve. Here, going to the lacrimal gland. Okay. Sensory nucleus receives taste sensation from the anterior two-thirds of the tongue. This is the tongue and anterior two-thirds of the tongue, except the velvet papillae. The spatial sensation is carried by the facial nerve by means of the chordae tympani branch of the facial nerve. Okay, so this is the nervus intermedius. We got that. The sensory root of the facial nerve here, formed by the central process of the unipolar cells of the geniculate ganglion. This is the geniculate ganglion. Okay, so it receives sensory root. It also receives the parasympathetic nuclear contribution. Okay, So it is formed by the central process of the unipolar sense of the genicular ganglion. Nervus intermedius also contains parasympathetic fibers from the parasympathetic nuclei. Okay, so we are going through that. It is going to supply the lacrimal gland. Here it is going to supply the submandibular and sublingual gland. Okay, so we got that. Now, what is the course of the facial nerve? Facial nerve has two roots, motor and sensory root of the facial nerve, comes out of the anterior surface of the brainstem between the pons and medulla oblongata, just lateral to the abducent nerve. They pass laterally in the posterior cranial fossa with the eighth cranial nerve. Eighth cranial nerve is the vestibulocochlear nerve and enters the internal acoustic meatus, that is an opening in the it is part of the temporal bone. Okay, at the bottom of the meatus, the facial nerve enters the facial canal. Okay, on the medial of all of the tympanic cavity, the facial nerve expands to form the geniculating ganglion. It passes to the posterior wall of the tympanic cavity. The facial nerve comes out of the temporal bone through the stylomastoid foramen. Once it comes out of the stylomastoid foramen, we have posterior auricular branch that innervates the auricularis posterior muscle and the occipital belly of the occipitofrontalis muscle. And we have also anterior component of the motor component of the facial nerve. It will divide into 5 branches in the parotid gland. One is the zygomatic branch here. The temporal branch, zygomatic branch, buccal branch, and the marginal mandibular branch and the cervical branch in the parotid gland. It will give rise to those branches. So temporal, zygomatic, buccal, marginal mandibular, and cervical branch. Okay, so the facial nerve, how it comes out of the brain. Okay, we have to go through that. In the posterior cranial fossa, it enters the internal acoustic meatus, then it is in the facial canal, then it comes out of the temporal bone through the stylomastoid foramen. It divides posterior division as posterior auricular nerve, and anterior division divides into 5 branches in the substance of the parotid gland. Facial nerve lesion, we have upper motor neuron lesion, lower motor neuron lesion. Upper motor neuron lesion that begins from the cerebral cortex. Okay, this is the upper motor neuron from the precentral gyrus area. Okay, so upper motor neuron, and lower motor neuron begins from the pons area and it is going onward inside the facial canal stylomastoid foramen. This is the lower motor neuron. This is the upper motor neuron. Okay, so upper motor neuron and the lower motor neuron. We have upper motor neuron lesion. Upper motor neuron has bilateral innervation to the forehead area. So in case of upper motor neuron lesion, there is compensation. So person can wrinkle the forehead. Okay, so in case of upper motor neuron lesion, in lower motor neuron lesion, what will happen? The entire side of the face will be paralyzed. In upper motor neuron lesion, what will happen? The forehead will be spared, but the site of lesion is here. Then other side of the face below the orbit will be paralyzed. Okay, so contralateral lower part of the face will be paralyzed in upper motor neuron lesion. The forehead area is spared. Lower motor neuron lesion, ipsilateral, it is not contralateral. Entire side of the face muscle will be paralyzed. So localization of the lower motor neuron lesion, it may be in the pons because we have the lower motor neuron is in the beginning. It begins from the pons area in the floor of the fourth ventricle, and then underneath the floor of the fourth ventricle in the lower part of the pons. Okay, in the internal acoustic meatus, we may localize the problem if it is associated with that the problem of the vestibulocochlear nerve, because vestibulocochlear nerve, facial nerve both enters the internal acoustic meatus. So any lesion here may also damage the eighth cranial nerve. So there may be hearing loss, there may be equilibrium loss. There may be lesion in the facial canal. So it depends on the site of lesion. If it is proximal to the stapedius muscle, then we'll get hyperacusis. If it is proximal to the geniculate ganglion, then we'll have loss of taste sensation. If it is in the parotid gland, then taste sensation will be intact. There will be no hyperacusis. Hyperacusis means that the excessive sound sensation due to the non-function of the stapedius muscle. Okay. Is there any lesion of the parotid gland? Just we have facial expression will be lost, but there will be no loss of taste or no hyperacusis or excessive hearing sensation. Okay, so let's start our clinical correlation. Paralysis of muscle of facial expression. It may be both in upper motor neuron lesion, lower motor neuron lesion. Upper motor neuron lesion, contralateral, lower half of the face below the orbit. Okay, lower part of the face below the orbit. Ipsilateral, complete facial muscle paralysis, that is in lower motor neuron lesion. Loss of corneal reflex or blink reflex. If it touch the cornea, the afferent component is carried by the ophthalmic division of the trigeminal nerve. The efferent component is carried by the facial nerve, that will be lost. So person will not blink the eye because the orbicularis oculi muscle is innervated by the facial nerve. Loss of taste sensation from the anterior two-thirds of the tongue, because anterior two-thirds of the tongue taste is carried by the chordae tympani nerve, that is a branch of the facial nerve. It picks up taste sensation from the anterior two-thirds of the tongue except the velar papillae. There may be hyperacusis, okay, that due to the lack of nerve supply to the stapedius muscle in the facial canal area. So Bell's palsy is lower motor neuron lesion that may be in the facial canal. It may be in the stylomasted foramen. We have supranuclear palsy. We have the sparing of the forehead muscle. We have crocodile tear that may happen. So there may be lesion in the facial nerve just proximal to the geniculate ganglion. So preganglionic fiber will unite with that of the fiber of the pterygoplatean ganglion. So when person eat, there may be lacrimation. Okay. Mobius sign, congenital oculofacial paralysis. This may happen due to the involvement of both the facial nerve and the abducens nerve. There will be medial strabismus, and also the problem is there will be muscular paralysis, lower motor neuron lesion in Mobius syndrome. Okay. And that's all about the facial nerve. We got it, mixed nerve. We may have upper motor neuron lesion, lower motor neuron lesion. We may have hyperacusis. We may have loss of taste, depending on site of lesion. Okay, so that's all about the facial nerve. If you have any question, please feel free to ask me. Please share the information with your friends, and please subscribe my channel. Please support me. Have a nice day. Bye now.